What is plantar fasciitis? Plantar fasciitis is a very common condition that causes pain in the heel and bottom of the foot and occurs when the plantar fascia, the thick band of tissue that runs across the bottom of the foot and connects the heel bone to the toes, becomes inflamed. What are the causes? 1. Overload. Excessive activity such as running, walking, or standing for long periods can put excessive stress on the plantar fascia. 2. Tension in the calf muscles. This can lead to limited flexibility of the Achilles tendon, which in turn strains the plantar fascia. 3. Overweight. Excess weight can cause excessive pressure on the feet. 4. Incorrect footwear. Shoes without adequate arch support or cushioning can aggravate the problem. Plantar fasciitis causes a sharp, stabbing pain, usually near the heel. The pain is often worse in the morning, when taking the first steps, or after sitting for a long time, and may worsen after standing, walking a lot, or exercising for a long time. How to make the diagnosis? The diagnosis is generally very easy and requires only a visit to evaluate the alignment of the foot and look for painful points on palpation. X-rays are more than sufficient in most cases, while MRI is reserved for patients who have had pain for at least 3 months, or in all those cases that do not respond to treatment with painkillers, physiotherapy, and stretching. It is a good idea to consult a specialist to rule out the possibility that the pain is caused by a back problem or is associated with a rheumatic disease. How can I reduce the pain? 1. Rest and ice to reduce inflammation. 2. Exercises for the calf muscles and plantar fascia. Find out how to perform them correctly through the link you will find in the description. 3. Physiotherapy is also very useful, such as extracorporeal shock waves. 4. Anti-inflammatory drugs. 5. Appropriate footwear with good arch support or custom orthotics. 6. Avoiding walking barefoot or wearing flat shoes is an important part of managing plantar fasciitis. Walking barefoot or wearing flat shoes like flip-flops or shoes with minimal cushioning doesn't provide adequate arch support. Without adequate support, increased pressure is placed on the heel and the bottom of the foot, where the plantar fascia is located. What shoes should I wear? 1. To manage plantar fasciitis, you need to choose shoes that offer excellent arch support. Good cushioning and stability are the main features to look for in shoes. 2. Shoes should support the natural arch of the foot to prevent the ankle from rolling inward or outward, and should avoid excessive stress on the plantar fascia. A well-cushioned sole helps absorb shock and reduce impact on the heel and foot, providing pain relief. 3. Solid heel cup. The back of the shoe must be solid to hold the heel in place and prevent unnecessary movement that can aggravate fasciitis. 4. Slight heel lift. Shoes with a slight heel lift of about 2 centimeters can help shift pressure away from the plantar fascia and reduce tension. 5. Wide toe box. Toes should have room to spread naturally without being constricted, which contributes to balance and comfort. 6. Supportive insole or orthotic. Many people with plantar fasciitis benefit from custom or over-the-counter insoles designed to provide additional arch and heel support. In cases of more severe and persistent pain, cortisone injections may be considered. What should I expect from a cortisone injection? To understand whether to perform a cortisone injection for plantar fasciitis, the doctor evaluates the intensity of the pain and whether other treatments such as physiotherapy, rest, orthotics, or anti-inflammatory drugs have not been effective. Tools such as ultrasound can be used to precisely identify the inflamed area and guide the injection. The foot is sterilized to reduce the risk of infection at the injection site. Using a small needle, the doctor injects cortisone directly into the painful area of the heel, often targeting exactly where the plantar fascia attaches to the heel bone. After the injection, the patient is advised to rest their foot for a day or two. Walking is possible immediately, but high-impact activities, such as running or hiking, should be avoided for about a week. The next day, some patients may experience a temporary increase in pain after the injection, which usually subsides within a few days. Applying ice to the foot can help reduce inflammation and pain after the injection. A follow-up appointment may be scheduled to monitor progress after 1 to 2 weeks. Cortisone injections for plantar fasciitis are effective for providing short-term pain relief, although they don't always address the underlying cause. While many patients experience relief for weeks or even months, treatment is often combined with physical therapy and orthotics for longer-lasting benefit. Doctors usually limit cortisone injections to no more than 3 or 4 times a year because of the risk of complications. What are the risks of cortisone injections? 1. Fat pad atrophy. Repeated cortisone injections can cause the heel's fat pad to thin, resulting in decreased cushioning and increased pain over time. 2. Plantar fascia rupture. There is a small risk of plantar fascia rupture, which can worsen the condition and lead to more long-term problems. 3. Infection. As with any injection, there is a risk of infection at the injection site, although this is very rare if correct sterilization procedures are followed. 4. Tendon damage. Improper placement of the injection could cause damage to surrounding tendons or other structures in the foot. Are there alternatives to cortisone injections? 1. Platelet-rich plasma, also known as PRP therapy. PRP involves injecting a small amount of your own blood into the affected area to promote healing. PRP is obtained by centrifuging a small amount of your own blood and is used for conditions such as tendonitis, arthritis, and soft tissue injuries. Learn more by watching the video via the dedicated link. 2. Prolotherapy. This involves injecting an irritant, such as a sugar solution, into the painful area to stimulate the body's healing response, particularly for ligament and tendon problems. 3. Acupuncture. Acupuncture can relieve pain by stimulating specific points on the body. When should surgery be considered? Surgery for plantar fasciitis is generally considered a last resort and is only recommended if conservative treatments have failed to provide relief after 6 to 12 months. What does the operation consist of? There are several types of surgery, and your doctor will recommend the best option on a case-by-case basis. Among the main types of surgery are complete or partial cutting of the plantar fascia. This procedure involves cutting the plantar fascia to relieve tension and inflammation. This procedure can be performed through an incision of approximately 3 centimeters to access and release the fascia. The procedure can also be performed using a minimally invasive technique, which uses smaller incisions and a camera to release the plantar fascia. Release of the superficial portion of the gastrocnemius. If tight calf muscles contribute to plantar fasciitis, surgical lengthening of this muscle can help reduce tension on the plantar fascia. What can I expect after surgery? 1. For the first few days, you may need to use crutches or a boot-shaped brace to protect your foot and avoid putting weight on it. Remember, to keep your foot elevated and apply ice to reduce swelling. During this time, it's best to avoid standing for long periods or walking for long distances, but no more than 15 minutes at a time. 2. Physical therapy is often recommended after surgery to restore strength and flexibility to the foot, and is usually started about 2 weeks after surgery. 3. You can resume light daily activities, but you should continue to avoid strenuous exercise or long walks until your doctor clears you. 4. Complete recovery and return to normal activities, including walking long distances or more strenuous activities, usually takes 3 to 6 months. What are the risks associated with the procedure? As with any surgery, there are risks such as infection, nerve damage, and ongoing pain. There's also the possibility of altering the mechanics of the foot, which could lead to problems in other parts of the foot or body. Surgery is generally very effective, but most doctors recommend trying all conservative treatments first due to the potential risks and lengthy recovery period. Thank you for subscribing to the channel and sharing its contents with your family and friends. Cortisone injections for plantar fasciitis are typically administered by a doctor.